Hi, guys, and welcome back to the Rare Wellness Podcast, the podcast designed to help you heal holistically and give you the tools that you need to thrive. We're making it easy to understand medicine and wellness with practical steps from the experts, one podcast at a time. The only thing that we ask is that if this episode helps you live just a little bit better and a little more aligned, that you'll leave us a review and you'll share this with a friend. That's all that we ask so that we can continue to provide you with free, valuable knowledge from the experts of well-being. In today's episode, we're going to be exploring the complex and often misunderstood topic of chronic pain, complex PTSD, and modalities like somatic therapies for moving through these experiences. Our guest, who we're so honored and so excited to have on, is Dave Berger. Dave has over 43 years of experience as a physical therapist, somatic psychotherapist, bodyworker, and movement educator. He is senior international faculty with the Somatic Experiencing International teaching all levels of SE training. He is part of Dr. Peter Levine's initial masterclass faculty, authorized by Dr. Levine to teach SE masterclasses. And Dave's own relational bodywork and somatic educational training base for trauma practitioners is an essential part of his decades of work in behavioral and physical health care. His clinical passion and expertise is helping clients who have complex PTSD, chronic pain, and syndromes survive near-death and out-of-body experiences. And his personal passions are his children, hiking, and bike riding. Dave, thank you so much for being on the podcast. I'm really excited to chat with you today.
You're welcome. Thank you for inviting me.
So I love to ask every one of our guests, what does wellness mean to you?
What does wellness mean to me? You've stumped me already. We usually often think of wellness in terms of either like the absence of illness, but that's sort of a cop-out in a certain way. That we all experience various levels of feeling great, physically, emotionally, spiritually, feeling not so great in the same domains. I think a well human being is one that can move between those and not get stuck. Oh, I feel great now, and this is how I am and will be forever. Where I feel absolutely miserable physically and emotionally, and I'm stuck here forever. Because the reality is life is more like that. And sometimes this has a very long arc, or this has a very long bottom, but we do go like this. Even if it's just a little bit, there's movement. And so I'd say wellness is the ability to have movement between these.
Yeah. Well, and that fluidity, like you described, it's no matter whether you're at a high point in your life or a low point, like it's bound to change. So if you can healthily move to that, I love that definition of wellness. So with that, as I kind of briefly mentioned to our listeners earlier, you've had an extensive career in somatic therapy, working through complex PTSD with people, understanding how the mind and body connect. How did you get into your line of work?
No. Well, I was a rebel teacher in the 70s when I went to college, and I decided nothing on campus really fit what I really wanted to study, which is actually true. But I found my way into a program called Individual Studies at University of Maryland, where I could design my own curriculum, make my own major. And I called it somatic psychology. Because I love biology and zoology and education and sociology and psychology. But how could I blend these into something? And so I was able to do that. I chose a direction for graduate school in physical therapy because psychology meant I would have to sit and listen to people complain all day, but I didn't want to do that. So I went to Stanford graduate program in physical therapy, but I was still always interested in non-typical healthcare approaches. In Maryland, in the 70s, I was also studying yoga. In fact, I got really, really involved in yoga. And
that's amazing.
For a long time. Anyway, make a pretty long story a little bit shorter. While I was in PT school, I still dabbled in non-traditional work. But my first job in physical therapy was working with people with traumatic brain injury, strokes, multiple sclerosis, spinal cord injury, and the like, and in pediatrics. And after a couple of years of that, I really delved more into what's now called bodywork, somatic therapies, et cetera, and really steeped myself in that. My work started to change work with people with chronic pain. Yeah.
So, yeah, I mean, you literally designed your own career. And I feel like nowadays somatic therapy and bodywork has become a lot more mainstream. Was that the case when you started doing it?
No, not at all. There were groups of people. There were certainly trainings to learn more, but there wasn't a really coherent, organized organization until there was, which was a little bit later on. I went back to a second graduate program in somatic psychology, where I could really start to put things together. And sort of the rest is history, having met Peter Levine then and understanding the world of trauma, et cetera. Yeah.
So for some of our listeners who might not be fully aware, what is somatic therapy and bodywork?
Well, yeah, I'm actually not a great, I don't really like the term somatic therapy. It doesn't say very much, really, because the word soma is a Greek word really referring to the body as an object, but it's really transitioned. Thomas Hanna, a few other people in the early 80s, late 70s, shifted the meaning of it to the living moment-to-moment felt experience of the body. And so when we talk in terms of, let's say, somatic psychotherapy, it's really body-oriented. How do you include the whole physiology, the whole person, not just their cognitive processes and emotions in psychotherapy? How other people use the term somatic therapy, I don't know, because I don't generally use that term.
Going back to that initial job out of college where you were working as a physical therapist, you said that you were working with people with complex PTSD or chronic pain?
No, neither, actually. So that was out of graduate school in physical therapy. I was working with people with major neurological challenges like
spinal cord,
spinal cord, et cetera. Working with people with chronic pain came 4 or 5 years later as I was shifting into the world of what's now called bodywork.
So we talked a little about somatic therapy, but then explain some of your treatments in bodywork and who do you work with? What kind of what does bodywork look like when people come and work with you?
Well, let's expand it a little bit. The idea of bodywork, to differentiate it, let's say, from physical therapy or chiropractic or whatnot, is the idea that the body can be changed a little bit, then the person can be changed. And so, for example, people with chronic pain have a looping, if they don't have actual structural organic problems. There's a looping effect that happens. And so the idea is, how can we break into this? Yep. So whether it's Rosie Method bodywork or Feldenkrais or Alexander or Rolfing or more hands-on bodyworks or somatic psychotherapies like Somatic Experiencing, which is kind of both EMDR, others, is how to break into that repetitive looping cycle. And so different bodyworks and different somatic psychotherapies address those in different ways, but essentially that's the underlying commonality, so that the felt experience from moment to moment, the living, breathing human being, will change a little bit.
So essentially what you're saying is that you can tap into healing the mind through modalities in the body, and same vice versa, that there's this like mind-body connection, and you can break that cycle through physical body work.
Very close. And that's how it's typically described. So let me say, saying the mind and body, or mind or body, or change one to change the other, suggests that they're two separate things. And they are not. They're the same, only we may pull to the foreground, or to the foreground, something in the background, one or the other at any given point in time, knowing that they affect each other all the time.
Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanthealth.com to get your supplements. My personal favorite is the premium fish oil filled with omega-3s. Again, you can go to rareplanthealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on, premium, intimate yoga studio with a therapeutic emphasis, bar classes, Tai Chi classes, if you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massaged or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode. What are some of the similarities between chronic pain and complex PTSD? What's the relationship between those?
Yeah. So in some ways, they're just different sides of the same quarter. That someone who has PTSD, often now called complex PTSD, all PTSD is complex. There's no simple PTSD. And people who have chronic pain have some similarities in what we call the dysregulation of their autonomic nervous system, meaning that the way their nervous system is designed to function in an automatic way. Things we don't have to think about, like our heart rate, our blood pressure, our pancreas, et cetera, our fight and flight responses, or those responses when they're not needed for fight or flight, but we need to walk more quickly. It's the same part of the nervous system, for example. That the relationship that these parts of the nervous system have is askew. It's not balanced. And we'll see that with people with chronic pain. We'll see that with people with PTSD. How we approach them, each of them is a little bit differently, depending on what else is in someone's background, but there's significant overlap in between both.
What is the difference between acute pain and chronic pain?
Yeah, acute pain, I mean, in by definition, is limited, depending on the injury or whatever's causing the acute pain. Maybe a few hours to a few days, maybe a week, or something in that nature. Then it goes to subacute. And if it lingers beyond many weeks, then it's often called chronic. So the acute and chronic. Acute pain is often tissue involved. So there's a bone fracture or a wound, or someone ate something that is now causing a gastro upset, but that resolves if it's acute, et cetera, et cetera, et cetera. Whereas something that's chronic has now shifted, and neurologically, where it is integrated in the brain, in the brain, has shifted from acute time frame, tissue healing time frame, to a more of a looping or a repetitive pattern. And now when chronic, so not only are we reacting physically, physiologically, emotionally to the injury, let's say, but we're reacting to the reaction, to the reaction, to the reaction, and the whole complex, brain, body, etc., is reactive in this way.
So you're describing this loop of chronic pain. What is the chronic pain cycle? What does that loop look like for people who experience it?
Well, chronic pain cycle will differ for different people and different kinds of pain, how involved or how complicated it is. So someone who has fibromyalgia, for example, may do fine for a while, but then for whatever the reason, the anxiety part of us increases, or prepare for an exam or an interview or a webinar or webinar, podcast. And then the system in us called the sympathetic nervous system increases in its activity, but it is almost like you know how when a fire dies down, there are embers, they're kindling, and it just needs a little wind on it to make it flare. Well, for someone who is in one of these patterns, that little breath of air to increase the kindling doesn't need to be very much, even less than usual, and whoosh, it all literally blows up. All right? There's a kindling effect. With fibromyalgia, with somebody with irritable bowel syndrome or chronic migraine headaches, there's a similarity. There's something that happens before the flare, but they present differently. But it's still that, at least part of it has this same looping pattern that can be interrupted.
Have you found that different types of chronic pain are caused by different specific events, or does chronic pain manifest the way that it manifests in different people? Like
what is the cause?
What is the cause, and are all symptoms caused by the same cause, or are they kind of different depending person to person?
Yeah, no, there will be different causes, and it will be different depending on the person. Let's say, for example, someone has had a shock trauma from an automobile accident where, there are many things that happen in that. Perhaps someone had a severely fractured lower leg. So there's a lot of pain with that. They do usually numb out, and then they're brought to a hospital. So there's ambulance, there's surgery, etc. And someone may do just great after they heal, but someone else might not. Part of that will depend on sort of what is the historic baggage that was brought into that moment. So the care given, how was the anesthesia dealt with, the hospitalization and all. And if there isn't a chance to really, really let down, finally the whole system rest and sort of get rid of all that energy that's stuck in the body, then it can go into this pattern. Whereas somebody, for example, I was actually consulting with a therapist this morning on a patient client who he's seeing, whose mother died when she was 6 years old. She's much older now. And within months developed pretty bad arthritic pain, full body arthritic pain. And so those are two very different scenarios, but both have a looping effect. Someone with arthritis, and also has a severe inflammatory process going on from the beginning, and the body's attacking itself. So how you work with that has some similarities, but also a lot of differences than how you work with the first person I was talking about.
Absolutely. Can you move out of chronic pain, or once someone develops chronic pain, what are some interventions that are out there?
Yeah, well, can you move out of chronic pain? Yes, or I wouldn't be doing this work.
Yeah.
I'd find a different line of business to be. Now, will it be 100% all the time? I'm good to go. I'll never feel it again. I don't hold a crystal ball. But it can change dramatically, and it may change enough where someone's life changes and they can get back into feeling more vitality and aliveness. And then when the pain is beginning to show again or more, they have interventions to reduce it. They know things to do. It's not a life sentence. For some people, it will go away entirely. And so it really varies. But like I tell all my students and therapists that consult with me and all, we can do all the great therapeutic work we do with hands-on, sitting psychotherapeutic model, with various movement therapies, etc. But if someone's underlying physiology and metabolism isn't good, then it's like planting a seed in soil that has no fertilizer. So nutrition is vitally important. what we eat really supports, or what we eat or don't eat supports or doesn't support healing of everything else.
I love that you're really bringing this into like a holistic approach of it requires all of it, right? It requires the somatic, the psychotherapy, the nutrition, and how all of it works together for healing. So just quickly on that nutrition, what are the things that can really help people and impact that physiology that you're talking about?
Well, nutrition is in the domain of a dietitian, a nutritionist, a functional medicine provider, a naturopath, and others. It's not my specialty. I know enough about it myself, and to let people know you really should see this person or that person about it. So I don't want to give information where it's not my expertise. Yeah.
No, that makes total sense, but that is important to look at. So So there's a variety of therapy interventions. I know there's cognitive behavioral therapy, there's pain reprocessing therapy, and your specific approach is somatic experiencing. Can you kind of speak to effective psychological interventions? How does a person know what's best for them?
Yeah, the second one is easier to answer, which is read about them, talk with a couple of practitioners, get a feel for the practitioner. Relationship is everything. Everything, whether it's this technique or that technique or this approach or that approach, more sitting psychotherapeutic model or hands-on model. If you feel comfortable and helped in the relationship, then everything else is good. So without a trusting relationship, that's not the person one see. In terms of all the different kinds of approaches, again, read about them, learn about them. You might try something. Does it fit? Does it meet my inner knowing that this feels right? Does it not? Talk with friends, talk with colleagues. We know we're not supposed to talk, we're not supposed to talk about our mental health or our physical health with other people. Physical health is okay, but mental health is not. Get over it.
Yeah.
Really important. One of the things that keeps us shut down and the chronic pain going is not talking about it, not receiving the support. So try them. In terms of, let's say, cognitive behavioral therapy, some very good aspects to cognitive behavioral therapy. It's well researched because it's it's fairly protocol and standardized. It can be very helpful. It's what we call a top-down approach, where the thinking brain drives it down. And I'm not doing it justice. I know that for all the CBT people out there. As opposed to other approaches that are what we call more of a bottom-up, like somatic experiencing, where the felt sense, the lived experience is not the only thing that's focused on. The cognitive is also, but the sensory awareness, the lived experience is a primary focus, but in a way that is just a little at a time, so it's manageable and doesn't go back into that looping over situation again. And then that will also feed eventually our thought processes, our belief systems, which is also working developmentally, because that's how an infant learns about the world, is really from the bottom up. They don't, for example, say, that's a ball. First it's this thing, you're rolling at them, and it bounces off of them, and eventually they learn it's called a ball, and then the beliefs, I enjoy playing ball.
Yeah. The example that you just gave of a kid in childhood with the ball, I want to dive a little bit more into that. So what is the link, I guess, between childhood trauma specifically and chronic pain? And how does that developmentally affect?
Yeah, that's a really important question. Children have, by nature, just a lot of vitality, a desire to be met, to be felt, a desire to reach out, a desire to express, etc. In an environment where a child can do that, they eventually become what we call self-soothing or self-regulating, meaning that they're having fun, maybe they get upset, but they can find their way back to settling and easing up again. In an environment where they can't, where that's not supported, and it might be a family where there's domestic violence, or a family that one child needs more attention because of severe medical issues, or they've been a family where that's been displaced by war, et cetera, where the child's nervous system, whole physiology, their spirit doesn't get a chance to thrive, or thrives a little bit, but then is shut down. Mm-hmm. So several things are happening. One is that the neural template, the nervous system's template for rebalancing is not established. And that's what everything else in our life is built on.
Yes.
Or is it built on a system that can be rebalanced on its own, or with support from another, or not? And if it cannot be, then that's when problems might arise. Very often do arise. When our system gets shut down, our vitality, our energy, we have to retain all that energy and depress it and push it down. Mm-hmm. Key word there is depression.
Yeah.
Several things happen. Eventually, we can become depressed or do depression. And sometimes it's expressed as really down, depressive, what we think of depression, sometimes in the very opposite direction of more rage, anger, but both are based in this. Another thing happens in that the normal vitality that is then being told, you want something to cry about, I'll give you something to cry about, right? So again, well, that's our fight energy too, a vitality, a fight, or that kind of energy system. And then that gets shut down. Well, that system's still operating. Part of our vitality system, our fight system, I want another lollipop, Daddy. Eventually that kind of fight gets shut down. But part of our fight system is our immune system. That's our physiological fight. And if that doesn't get a chance to reset to baseline, then it is, I was talking about that kindling before. It's a little bit in kindling mode, always, always, always. And so now we've got a musculoskeletal system, we've got an immune system, those involve the cardiovascular system, the gastrointestinal system, et cetera. And eventually those may all be affected. There were studies done in the late 80s, early 90s called the Adverse Childhood Experiences, ACE studies, and brilliant research in Kaiser, Southern California, where they've got thousands and thousands of records to research. And it was shown that, so there are 10 on the scale: poverty, domestic violence, sexual assault, displacement, et cetera, et cetera. And if you check off more than 4, there's a one-to-one correlation with different medical syndromes in midlife or later.
Wow.
Cardiovascular, chronic musculoskeletal pain, gastrointestinal, et cetera.
Yeah.
So the significant, maybe this is why it's called complex PTSD, is because it's complicated.
Do you feel like have you experienced through your work that there's a lot of people who may not know that they've experienced complex PTSD or have been in environments where it was normalized, and they're seeing this manifestation in their bodies, but they don't even know that it's rooted in something deeper?
And much earlier, you're like, oh, yeah, for sure.
Yeah.
It's not uncommon to ask someone, tell me about, what do you know about your childhood? It was great. It was great. Well, as you work with somebody, over the years, find out it wasn't so great. Let's not even make everything in the negative. Sometimes, and I've had clients like this, I have friends like this, who grew up in circumstances that were just not good. Various different reasons, and they turned out well. They've done a lot of work on themselves, but they turned out pretty well.
Yeah.
In other words, things can change.
Do you know, is there a reason why some people respond to certain events and in one way and another person will experience chronic pain or the manifestation of that in their bodies and someone else won't?
Yeah, that's a really good question. And I don't know the answer to that question yet. We do know, I think, from clinical examples, that not everybody reacts to an experience or an event in the same way.
Right.
And one of the real turning points in understanding trauma was, and many turning points in understanding trauma, was developed by Peter Levine, Dr. Peter Levine, who developed Somatic Experiencing, who wrote early on in the 70s, trauma is not in the event, it's in the body. And the trauma reaction is a physiological reaction and response to events. It's not the event. Which means what? Events already happen, or events are outside my body. I might not be able to control those, but my body can change.
Yeah.
And I can change in relationship to what happened 30 years ago, 40 years ago, 5 days ago.
Yeah.
It already happened. That's over. My relationship can change.
So if I'm understanding this correctly, then what might be traumatic, what affects what one person internalizes in one way may not be traumatic for another person.
That's right.
Yeah.
Exactly. That's the idea. Now, there are some things that we experience that everybody will be traumatized more living
Totally.
For example.
Yeah.
But again, it's not the war zone per se. It's our physiological reaction
Response.
of being. Exactly. Yes.
Yeah.
I might be walking through a very dangerous area.
Yeah.
And I'm like, Liz. Or I can say, oh, I can feel myself tightening up. I'm going to soften my tongue. I'm going to exhale, soften my tongue, and I'm going to still walk through the same area. It's not changing the area, but it's changing my relationship with it. And I can still be aware. Probably even more efficiently aware. Yeah.
Man, I wish this was something that was taught to us more when we were kids. And just overall and having those tools. I found it really fascinating. Earlier, you mentioned those 10 different boxes where if someone has checked off that they experience these things, the likelihood that they'll experience some sort of chronic illness as a result or in correlation is just astonishing. That's crazy. Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanthealth.com to get your supplements. My personal favorite is the premium fish oil filled with omega-3s. Again, you can go to rareplanthealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on, premium, intimate yoga studio with a therapeutic emphasis, bar classes, Tai Chi classes, if you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massaged or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode. Do different emotions experience themselves differently in the body, like anger versus sadness versus, do we internalize different emotions differently? Where does the body store trauma?
Yeah, well, there are a lot of parts in that question. The body, where there's no locker room for trauma in the body. It's a full psycho-spiritual, physiological, thing. We have a physiological reaction, but our response is all of us. Mm-hmm. Let me reframe an idea about emotions.
Tell me.
And this comes from the neurophysiology, neuroanatomy of emotions, and actually even earlier than that, brilliant bodywork Paul Linden really developed this idea as well. And I've been using it for decades. Emotions are behaviors. We do emotions. We don't feel emotions.
Interesting.
So bear with me here.
Okay.
Our body has sensory endings throughout, everywhere in our body, from our skin, our ears, our intestinal tract, everywhere. And those sensory endings take in information from outside the world, inside the world, movement, etc. And that sensory information is sent up into the midbrain. It's called the midbrain, the limbic system, and it's interpreted. Like this algorithm of sensory information at this moment in time.
Mm-hmm.
Is it in the okay category, pleasant, or not okay, not pleasant? It just categorizes. And then there may be a lot of variations on it. With the brain also, the brain body, want to know, what do I do with that algorithm, that interpretation? So that interpretation is sent on to memory area of the brain. Well, yeah, I know this. This is what you do. Facial expression, change in heart rate, muscular action, etc. So sensory in, motor out. E, externalization through movement. Emotion.
Motion.
You do it. Right? And then we interpreted higher brain levels into a label. Sad, angry, joyous, shame, etc. The reason this is so important, one is it's because it's neuroanatomically accurate, but functionally it's important because if we shift how we do the body, we can shift our physiological state and then therefore our relationship with the world and ourselves.
Wow.
I'll give you, you want to play with this for a moment?
Yeah, let's play with it.
All right. So allow your tongue to soften for a moment. Now, just ask the corners of your lips to go up toward your ears. Yep. Okay, that was a big movement, but interesting. But what do you notice all throughout? What would you feel if we use that kind of terminology for emotion?
Happier, lighter. Yeah.
Nobody's saying anything about happy or light, right? You shifted sensory information going into your brain and interpret it. And then there was a little laugh. So sensory, motor.
So does this mean for people listening that when I'm going about my day-to-day life or I have events that typically I would interpret as, oh, this is bad, or this is something that's going to now like tense up my muscles, make me angry, make me isolate, that if I take in those deep breaths or change what I'm doing with my body, I can control how my brain is going to store that event in my mind?
Mm-hmm.
Yeah.
It's not that simple.
Okay.
But this is the idea behind it. This is behind a lot of what we call somatic psychotherapy, bodywork, etc. Mm-hmm. Shift how the body is functioning to change things. Yeah.
So what are some of those shifts that some of our listeners can practice?
Oh, well, my favorite is to soften your tongue. Allow you to soften. And actually, there. See how your belly relaxes a little bit also? Yeah. So which changes your breathing, often down into the pelvic floor, which is the base of startle, of anxiety, of fear, of terror, all of which lead to chronic musculoskeletal pain and all kinds of other things. Right. Yeah. That's one.
I can see the major value of having the background of physical therapy in your practice and in your work.
It helps. Typical physical therapy isn't this, but it helps to really know the anatomy, the neuroanatomy, the physiology. Absolutely. Yeah. And background in psychology and psychotherapy to understand relational dynamics and belief systems and developmental, psychosocial development and all. Yeah.
So you mentioned softening your tongue. Are there any others?
Let's just stay with that for now. I think that it gets more complicated as we go further. Yeah.
Totally. So I guess if someone listening to this has experienced chronic pain or like what are ways to lessen the intensity or duration of that for them?
Yeah. Well, sometimes the short-term use of medication can be very helpful. Working with a practitioner who really understands chronic pain, meaning some of the relationships and the dynamics we've been talking about today, knowing healthful eating, I'd say those would be the three most important things.
Have you experienced any case studies or do you have any stories that you would be willing to share of transformation or working through chronic pain with someone in your own practice that might be interesting for our listeners to hear?
Oh, to pick out just one, that's very hard to do. Yeah. I was working with a guy, this is a number of years ago, who had pretty severe, he had pretty bad anxiety. He had panic attacks and whatnot. And I mean, he did very, very well. His panic went down significantly, went away really until a certain point. It came back, but that was fine. Went away again. The chronic musculoskeletal pain at one point, I mean, I saw him for about a year. He took time off, about a year off. He came back. And the pain had diminished a lot. It didn't go away entirely. He came back because he had a bit of a flare-up with both the panic and it was circumstantial. This is what things go up and down. They get better and better, drop better, like that. And there was one point in time where we were working and he came in and he said, I don't feel I don't feel right. Something feels kind of not me. And I could get a real sense that his musculature was going from more braced to more relaxed, which sounds like a good thing, except he was starting to go into more of a collapsed mode, which was not like him at all. Now, if I was a regular talk psychotherapist, I'd try to why, but but I'm not, and that wouldn't go anywhere. So I had him go into what I call consolidation posture. Had him go into more of a plank yoga, where every muscle of the body has to work, which sounds contraindicated for someone with that kind of musculoskeletal pain, but it wasn't. And he did that fine. He got very fatigued pretty quickly, rested, did it again, and then rested and turned over on his back. And he had some severe pain in the upper part of his gut, which he'd never really had before. But I knew that it wasn't about anything we'd done. And then I started to do a little hands-on work, but I couldn't get there because it got very sharp. So I said, ask your mom if when you were a kid, you ever had, do you know if you've ever had GI problems? And he said, no, never. So ask your mom. Now he's in his 30s, but
yeah,
did ask his mom. It turned out that between, I think it was 3 or 4 months and 9 months, he had colic. So this predisposition toward this started when he was an infant and resulted eventually in these symptoms. There was more to the story than just those.
Of course.
But the bracing, which is, he didn't have fibromyalgia, he wasn't diagnosed, but he could have ended up there. It's like a bracing pattern. And then the GI all intertwined from when he was an infant. And he did great. He really, really did well.
No, it's amazing to really see how every single event that you experience in your life has this effect on your body, mind, vitality, all of it. I also love that you take yoga, that you have all of these different elements influencing your practice and your therapy, including the yoga aspects of it, which I love. And at Rare, we have an entire yoga branch and somatic yoga. So it's really cool to learn more and hear about that and the different approaches that you take. So Dave, I have a question for you. we love to end every episode with a practical tip for our listeners. So I know we've covered a couple, but if someone listening today forgot everything except for one thing, what would that one practical tip that they can take away from this be?
Well, I'll quote one of my mentors, Dr. Peter Levine. He says, trauma is not a life sentence. And it's not. Things can change. Finding the right practitioner who really understands you, understands the complexities, and that you feel comfortable with is so vitally important in that direction.
Yeah. Well, Dave, thank you so much for your time today. I really enjoyed talking to you. I feel like I learned a lot. If our listeners want to know more about your work, or maybe they're looking for a good practitioner, where can they find you?
Yeah.
Where can they find out more about your work?
Well, they can look at my website, which is simple, daveberger.net. I'm not seeing clients now. My travel, teaching, consulting schedule doesn't allow me to do that. It's very busy. They can also go to traumahealing.org, which is the Somatic Experiencing website, and there's a directory there. In that, they can look for practitioners through that.
Love it. Well, thank you so much for your time. And to all of our listeners, if you have questions that you want to ask us, DM us at Rare Wellness Podcast, and we'll see you guys next Friday for a new episode. Bye.